Hi, I'm Dr. Achala Abeywardena, consultant in obstetrics and gynecology. I'm going to discuss about endometrial polyps today. What are endometrial polyps? They are growths in the cavity of the womb which arises from the inner lining of the womb. They can be single or multiple. Are endometrial polyps common? They are seen in between the age of 40 and 50 commonly. However, that they can occur in women who are below age of 40 when there is a hormonal imbalance. How can we know whether a woman is having endometrial polyps in the womb? There could be several clinical manifestations. The common manifestation is bleeding. The menstrual cycles could get abnormal. They could get very heavy, or they could have abnormal bleeding which manifests with prolonged bleeding or bleeding in between menstrual cycles. Sometimes there could be bleeding after menopause, that is called as postmenopausal bleeding. Not only bleeding, there could be severe pain during menstruation, which we call as dysmenorrhea. That could also be a manifestation of endometrial polyps. Sometimes some women may present with inability to get pregnant, which is called as infertility or subfertility, and the cause could be polyps arising from the inner lining of the womb. This sort of a clinical scenario, what can we do? You should immediately seek advice of a consultant in obstetrics and gynecology. He or she will advise you on what to follow. Usually he or she will request or perform an ultrasound scan, which is mainly done through vagina, which is called as a transvaginal ultrasound scan, and performer has the ability to identify endometrial polyps easily. Sometimes they could recommend you a process called hysteroscopy, a small camera inserted into the cavity of the womb to identify the polyp and to act upon it. This could be done without anesthesia or with anesthesia. However, sometimes if a procedure is done, anesthesia may be required. And when a hysteroscopy is performed, the operator could identify the polyps and could remove the polyps at the same time. What are the importance of acting upon endometrial polyps? If the polyps are very small and not symptomatic, they could be left alone and followed up regularly. However, if the polyps are large and symptomatic, they should be removed. The removal of polyps is recommended to alleviate symptoms, as well as to make sure that the malignant transformation of these polyps does not happen. In women between 40 to 50 years of age, the chances of this converting into a malignancy is about 5%, while for women who are postmenopausal, it could be up to 10%. So I hope that you got clear picture of endometrial polyps and why we need to act upon it and how we can act upon it. Thank you for your listening.